2,112 new COVID-19 cases and 15 coronavirus-related deaths were reported today during the CCSA's daily briefing. There are 30,222 current active cases with 1,042 COVID patients in critical condition, including 343 on ventilators. And just before we get into the bulk of today's general news, a shout out to Edward Ketterer. Thank you very much for becoming a Thaiger legend. Also like to thank everybody that's upgraded to our app. Have you checked out the app? It's on iOS and on Android, and you just go to your App Store or to your Google Play Store and type in the Thaiger and you'll find our app. And it's really easy to use, and you can get all the news you want, including world news, with just one tap. Now time for the news. Officials are accelerating vaccination efforts in the Klong Toey district of Bangkok, along with proactive mass testing in an effort to control the current cluster. Thai PM Prayut Chan-o-cha says the aim is to inoculate at least 50,000 of the approximately 90,000 residents ASAP to bring the infection rate under control within 2 weeks. The mass rollout began yesterday with assistance from local residents, state agencies and the private sector. There's concern about the Klong Toey outbreak as many residents travel from the slum communities to work in other areas of Bangkok as well as in neighbouring provinces. Meanwhile, the CCSA reports that a new cluster of 162 infections in the Bon Khai community in the Bangkok district of Pathumwan is of concern. Yesterday, 61 new cases were reported in that community. With the steady number of COVID-19 cases and deaths in Bangkok, hospitals are being pushed to their limits, with a new ICU field hospital opening to take up some of the caseload. Up to now, field hospitals have been used for patients who are asymptomatic or who have mild symptoms. Those with more severe symptoms have been treated at hospitals. But the Bangkok governor says they plan to set up more ICU field hospitals to make sure that intensive treatment will be available if the infection rates rise. The Chalerm Pra Kiat Stadium in Bangkok's Tung Kru district has already been converted into a field hospital. It can house up to 432 patients. One of Thailand's most prominent Buddhist monks has been accused of meddling in politics after he criticised the government's handling of the COVID-19 crisis. The Sangha Supreme Council has found Pra Maha Sompong Talaputo guilty of expressing political views which is considered inappropriate for a monk. The monk and popular preacher from Bangkok's Soi Tong Temple is renowned for his humorous talks, often with a sarcastic political comment thrown in. We should get him here on the Thaiger. The Office of the Prime Minister says the government had ordered the National Office of Buddhism to ask the Sangha Supreme Council to investigate social media reports that had criticised the government over its handling of the local outbreak. He says that the council has confirmed the claims and ruled against the monk to ensure it doesn't happen again. The monk is a long-standing critic of the Thai PM. Whilst we're on monks, a 64-year-old monk in the Isan province of Buriram is suspected of running off with 70,000 baht in donations intended for the temple. The monk, as well as the thousands of baht in cash, have been missing for the past week. The abbot of a temple in the Nan Rong district had made a request with the temple committee one morning before he went off for his daily routine. He'd asked to withdraw the money to pay workers to build a new crematorium. On April the 28th, the monk received 70,000 baht in donations and then told the committee he had to visit a doctor at a local hospital. The monk left the temple grounds, allegedly taking the donation money with him. No one's seen the monk nor the money since that time. A young Pattaya motorist whose car burst into flames while he was driving to the bank says he's lost 1 million baht in cash in the blaze. The 24-year-old Thai driver says he was on his way to deposit the cash at the bank yesterday when his car spontaneously caught fire on Sukhumvit Road in South Pattaya. Firefighters arrived on the scene around 12:30 to find the car fully ablaze. It took them 10 minutes to extinguish the fire. But the driver told the emergency responders that he was heading to the bank to make a deposit. He said he tried to grab the bag full of 1 million baht cash and a mobile phone after smoke started pouring out of the engine compartment. Officers from Chonburi Police are investigating the cause of the fire but have not commented on the driver's claim of the million baht that allegedly went up in smoke. Thailand's Koh Phi Phi Marine National Park is closing for 13 days from today. The park chief says that the decision was made as Krabi province is seeing a rise in infections. He said to control the wide spread of the virus, the park management has necessary reason to use measures to control the area under our responsibility, and that all tourist attractions and activities are suspended from today until May 18, but officers of the park are still required to work as normal. 72 other national parks have already been shuttered since April 22. 83 remain open, but 25 are closing some attractions. Medical experts are voicing their concerns over the BMA's plan to use the antiviral drug favipiravir to treat field hospital patients. Field hospitals are currently being used for so-called green COVID-19 patients, those with only mild symptoms or none. Favipiravir, sold under the brand name of Avigan, among others, is an antiviral medication used to treat influenza in Japan. It's also being studied to treat a number of other viral infections, including COVID-19. Earlier this week, the Bangkok governor said that officials would treat field hospital patients with favipiravir as soon as they were admitted. He said patients would be given 10 tablets a day over 5 days, amounting to a total of 50 tablets per patient. But the Public Health Ministry has called for the proposed treatment to be approved by medical experts before it goes ahead. Yeah, that's a really good idea. This comes as a result of a number of medics raising concerns about the treatment, particularly the risk that patients could develop resistance to the antiviral treatment. Doctors from the Faculty of Medicine at the Sirirat Hospital say there is currently no clinical data to support claims that it can reduce severe illness or lung inflammation, saying the medication was approved for emergency use during the first wave of infections and was only used in patients with severe lung inflammation at the time. The BMA are meeting with medical officials today to discuss the studies. And we hope that some common sense emerges from that meeting today. Well, that's all we have for our midweek edition of Thailand News Today. We've got Jet hosting the program tomorrow. Please don't forget to subscribe to the channel, and you can also join as a member. And let's see, probably on the weekend we'll tell you about a new program that we're starting in the next few weeks. Quite exciting news, and we look forward to getting your response from it. In the meantime, thanks for joining us, and we'll see you next time.